Hi, my name is Sue Pascoe, and I'm a staff writer at the Palisadian Post, which is a weekly newspaper in Pacific Palisades, and I do the monthly healthy column, and I'm not feeling healthy right now, but anytime one of our readers has an issue about fertility, about miscarriages, about anything to do with reproductive, I go to speak to one of the top fertility specialists in the United States, Dr. Ingrid Rodi, to help me clarify so that I'm able to explain to our readers what's going on. And today, I'm wondering, what do you do if you're infertile? How do you know if you're infertile? And I thought maybe Dr. Rodi could help us.
Well, the first thing that couples need to know is that when they're considering getting pregnant, they should consult their family doctor or gynecologist for preconception counseling. That means going in before they actually get pregnant to determine if there are any changes in their medications that they need, or if there are any medical problems that might complicate their pregnancy, and if there are any genetic mutations they're at risk for. And the gynecologist will go over all those things and give them the go-ahead. Start her on vitamins, on folic acid.
Oh, so you should be taking vitamins even before you conceive?
Yes, so, at least about three months before. There's also...
But it used to be so easy. Couldn't you just go and get pregnant and that's done with it? Why do I have to go see my doctor before I even try?
Well, you want to optimize, the chance that the pregnancy is going to be as easy as possible and that the baby is going to be as healthy as possible.
Okay.
And once, the couple's been given the go-ahead, if the woman is under 30, it's usually suggested that they try for a year.
Okay, now by trying for a year, what does that mean?
That means either...
I mean, how many times am I having sex a week? What are we talking here?
Right. That means either just having sex regularly, meaning 3 to 4 times a week, or using an ovulation prediction kit, which tells her when she's going to ovulate. So
okay, so we've all seen it on TV, funny, I'm ovulating, home quick. Is that really accurate?
Well, it's very helpful, especially if couples are frequently out of town and they're really trying to maximize the timing. Then the kit is very helpful.
Okay, so then if I'm under 30, I'm having sex regularly, or I'm using the ovulation kit. Now there's an old wives' tale too, that after you have sex, if you're a woman, you should put your feet up. Does that actually have any truth to?
No.
Oh, okay. So
as long as everything's where it's supposed to be, you don't have to do anything.
You don't have to lay in bed for another hour. Okay, rad. Okay, so now I'm under 30. I've been having sex regularly for a year, and I haven't gotten pregnant.
Okay, so then the couple comes back, or if the woman's trying to get pregnant on her own, she comes back, and we look for those areas which are considered deal breakers. So you need to be ovulating.
Why wouldn't I be ovulating? Doesn't every woman ovulate?
Not every woman ovulates, and not every woman ovulates regularly.
Oh, really?
So
so if I'm one of those people that doesn't have a period every month, would I be one of those irregular ovulators?
Yes. Yes. So we look for...
Is that normal?
No, it's normal to have a period every month.
Okay.
And if a woman's having a period where the interval is more than 5 weeks, then she may ovulate, but she doesn't ovulate regularly, or at least not every 4 weeks.
Can you as a doctor change that then so that she can ovulate more regularly?
Yes, there are medications we can give her to ovulate more regularly in most cases.
Okay, so one of the things is then if I come in having that problem, you would check for regular ovulation.
Right. The next thing we need to know is if the man has sperm and whether he has an adequate number of sperm, and we do a semen analysis for that.
Okay, so what would be an adequate number?
Well, I
thought it only took one.
Yeah, it only takes one, but they have a long way to swim, all the way from the cervix all the way out to where fertilization occurs. So you need actually more than one. You need
you need one, you need the super sperm to get the job done.
Right. So you need the normal semen analysis would have 20 million per cc, and usually the usual volume is about at least 2 cc's per ejaculate.
Okay, now when you say cc, how are we talking? A teaspoonful? Are we talking a pinhead? What are we talking here?
You know, well, several drops certainly.
Several drops, okay.
Yeah. So that's measured in the lab. So
Right.
they measure that.
Okay,
And,
so my partner, who might not be thrilled about this, will go to a lab and produce a little
Right.
petri dish full of
Yeah.
semen to be looked at.
Exactly.
Okay.
And then we also need them to be swimming in the forward direction.
No backstrokers?
No backstroke. Right. Well, as long as they go forward. So they need to. We look at both the count, the motility, and how many of them look normal. You know, so one of the things that we're looking at is whether the sperm have normal heads.
Oh, look at that one's a two-header.
Yeah.
Some of the sperm have two head.
Yeah, some of them have two heads, and
Will that
some
give you
of them,
twins if you have two heads?
No, they typically don't do much of anything, and some of these have two tails. So you really want
This one looks like a pointy head.
Yeah.
He's not a good swimmer then either.
No, all of these. This is the normal one, and all of these are not so good.
So could one of them make him up there, or probably not when they look
Probably
like-
not.
Okay.
Probably not. This is the best way to get up there.
Okay, so if you go in then and you find out the problem is the sperm, then what do you do?
Then there are specialists who evaluate the male and see if there's anything they can do to improve the situation. If not, then we sometimes have to treat the woman to compensate for the problems in the man. And one of those treatments is insemination, artificial insemination, or in vitro fertilization.
Okay, now I'm sorry to sort of go this, but I haven't heard much about what how can a man improve? I mean, just not be as stressed as much? Would that make better sperm?
Well, one of the things that the male fertility specialist will look at is whether he's on any medications that have a bad effect on the sperm. Men who smoke marijuana often have sperm that are pretty slow swimmers. So,
and they get munchies on the way up, I'm sure.
yeah,
Okay.
it's not enough for contraception, so I don't mean to suggest that marijuana is contraception, but it may slow them down. So they have an evaluation of their hormones and a physical exam, and if all of that turns out to be normal, we can inject the sperm into the egg during in vitro fertilization.
Okay. So now we've gone through a possible ovulation problem, a possible sperm problem. What else might you evaluate me for? We find out that I'm ovulating fine, the sperm seems to be fine, and we're still not getting pregnant.
So you really need the fallopian tubes to be open.
Oh, can you ovulate even if the fallopian tubes are not open?
Yes. So the fallopian tubes need to be open because the eggs come from the ovary. Fertilization occurs in the fallopian tube, and then the embryo goes down to the uterus. And if the fallopian tubes are blocked, you can ovulate, but you can't fertilize the egg.
Where does the egg go then if they're blocked?
It just disintegrates.
And then that means the sperm can never get to the egg.
Right.
What causes blocked fallopian tubes?
There are a number of causes. A woman can have a ruptured appendix, and that infection can cause a blockage of her fallopian tubes. She can have a sexually transmitted disease such as chlamydia or gonorrhea, and that could block the tube. She could have endometriosis and have a blockage as a result of that. So it's very important to find out if the fallopian tubes are open, because otherwise you can't get pregnant on your own.
What if you find they are blocked? Then what do you do?
In some cases you can open them, but in the majority of the cases you undergo in vitro fertilization, which can bypass the fallopian tube. So we remove the eggs, fertilize them in the dish, and then we put them into the uterus, so we bypass the fallopian tubes.
Okay, so what else could be a problem then for?
Those are the major ones. Those are the ones that we call deal breakers, because if you don't have sperm, if you don't ovulate, And if you have blocked fallopian tubes, those are pretty serious problems.
How about, say I'm 45 now, and I've been ovulating, I'm 45, I look very youthful, I've kept myself in great shape, I've got a younger partner, so his sperm is fine. I know that we know the fallopian tubes, why would I be not getting pregnant then?
Well, because we know that it takes more eggs, or more cycles, or more trying, to actually get to the one egg that's going to be normal. Because with age, the percentage of eggs that are affected by all kinds of abnormalities goes up.
But I'm so youthful. I mean, I can do a triathlon. Why would my eggs not be as youthful as I appear to be, even though I'm 45?
We're not sure, but we think that it was an evolutionary advantage not to have babies in our 40s and 50s. So,
are you saying so that even though I can keep my biceps relatively good, there's no exercise to keep these eggs sort of young?
The only thing you can do is not smoke cigarettes and not get radiation or chemotherapy to your ovaries. Those things accelerate the loss of fertility, but otherwise your ovaries are on their own time clock.
They sort of every year get older no matter what's going on in my life.
That's right.
Okay, so then that probably would be a key thing you would ask too if I come in, is my age.
Yes.
And if I'm 50, can I still get pregnant then?
If a woman is 50, her uterus may be able to carry a pregnancy, but the likelihood that she would be able to get pregnant with her own eggs is very remote, less than 1 in 1,000. So in that case, some women will carry either an embryo that was made from a donated egg or a donated embryo from a younger woman. And that is often a very good solution for a couple where the woman is already past fertility.
When you say past fertility, what age are we sort of looking at? Past fertility, what?
Well, at 38 it's 50-50, and at 47 it's basically 100%.
So if I want to get pregnant without using a donated egg, then I really should do it before 38.
Yep. To start trying. And some women who want to postpone childbearing will either freeze their eggs or freeze embryos for later use.